So JP, people go to a workshop and they go, yeah, that's sort of what I do anyway. Is it enough for someone just to attend a workshop of CFT and to go away and practice?
And that's probably one of the key learnings from Restore. Workshops, they are necessary. They're super important for you to sit back, observe the evidence being presented to you. And that in itself may be challenging for some, or maybe not be challenging because you're already in that mindset. And Restore was a great example because every clinician that entered the trial to be trained, they had an interest in a biopsychosocial approach. But that is very different from you having to practice it. And in Restore, the knowledge workshop was interesting. They reported as being very informative and applicable, and very aligned with what they thought they were doing. And when it came to the skills workshop, a few blind spots became clear because in the skills workshop, they were actually put in a position where they had to demonstrate how they would deliver that. So instead of saying, this is what I would tell my patient, is like, this is how I tell my patient. And that situation of being kind of put on the spot to have to deliver it in a environment where you're not being judged, but you're being supported, it really highlights your practices of communication and your beliefs about pain. And that was an eye-opener for quite a few of the trainees. And we've done studies in the past where that was the only thing that the trainees had access to. They had access to an observation workshop, they watched someone delivering it, and then they had to deliver it. And the qualitative report from that study indicates that they didn't feel that that was enough. They felt like they needed guidance to be able to apply their knowledge and those skills effectively into clinical practice. So experiential learning and guided mentoring is essential to deliver this care.
Yeah.